morning to Sir Safiq. So today we want to present our musculoskeletal disorder, that is elbow injuries. For first and foremost, my name is Tuan Nama Afiq Warhan bin Sunali.
My name is Raja Mamtaki bin Raja Ismail.
My name is Muhammad Atiq bin Mali.
In this video, we're going to talk about anatomy of the elbow, types of elbow injuries, mechanism of causes, and how to treat the injuries, exercise to be done for the elbow injuries, and functional tests of elbow injuries.
The anatomy of the elbow joint. At first, the elbow seems to work like a simple hinge, but the elbow is a complex joint whose motion affects the forearm and the wrist joint. It is easy to see why the elbow can cause problems when it does not function correctly. Part of what makes us human is the way we are able to use our hands. Effective use of our hands requires a stable painless elbow joint. The skeleton of the elbow contains radius, ulna, and humerus. The bones of the elbow include the humerus or the upper arm bone, the ulna, the larger bone of the forearm on the opposite side of the thumb, and the radius, the smaller bone of the forearm on the same side as the thumb. The elbow itself is essentially a hinge joint, meaning it bends and straightens like a hinge, but there is a second joint where the end of the radius or the radial head meets the humerus. This joint is complicated because the radius has to rotate as you turn your hand palm up and palm down, while at the same time it has to slide against the end of the humerus as the elbow bends and straightens. To make this motion possible, the radial head is shaped like a smooth knob with a shallow cup at the end. The shallow cup fits against the capitulum, a rounded knob at the end of the humerus that forms part of the elbow joint. The smooth rim of the radial head is also covered with articular cartilage and glides against a small indentation in the ulna. There are several important ligaments in the elbow. Ligaments are soft tissue structure that connects bones to bones. The ligaments around the joint are connected with a thin layer of connective tissue and form a structure called the joint capsule. Joint capsule is a watertight sac that surrounds a joint and contains lubricating fluid called synovial fluid. In the elbow, two of the most important ligaments are the medial collateral ligament and the lateral collateral ligament. The medial collateral ligament is on the inside edge of the elbow. The lateral collateral ligament is on the outside edge. Together, these two ligaments connect the humerus to the ulna and keep it tightly in place as it slides through the groove at the end of the humerus. These ligaments are the main source of stability for the elbow. They can be torn where there is an injury or dislocation to the elbow. If they do not heal correctly, the elbow can be too loose or unstable. Another important ligament for elbow function is the annular ligament. This ligament wraps around the radial head and holds it tight against the ligament. The word annular means ring shape, and the annular ligament forms a ring around the radial head as it holds in its place. This ligament can be torn where the entire elbow or just the radial head is located. There is a large number of muscles which cross the elbow joint, enabling it to flex, extend, supinate, and pronate. Following are the largest and most commonly injured place. First is the biceps brachii. It flexes the elbow joint and supinates the arm. Next is the triceps brachii. It is the main extensor of the elbow. Brachialis is the strongest elbow flexor when the palm is pronated. Then we have the brachioradialis. It flexes the elbow, aids pronation and supination. Then we have the pronator teres. It is to aid flexion of the elbow and pronate the forearm. Last but not least, we have the extensor carpi radialis brevis. It is to extend the wrist and aid extension of the elbow.
Olecranon fracture is the break in the bony tips of the elbow, which is the part of the ulna. Olecranon bone is positioned directly under the skin of the elbow. It's only covered by the skin, so it can be break easily. Olecranon bone is the attachment of three bones, which is humerus, radius, and ulna. Causes for olecranon fracture is falling directly on the elbow, fall with outstretched hand, and receiving direct blow of an object. For acute treatment of olecranon fracture is, you can apply an ice pack. Second, you can use any medication in order to release pain. In order to support your elbow, you can use the splint. For surgical treatment of olecranon fracture, open reduction and internal fixation is the suitable technique. The doctor can use tension band wire technique or plate and screw fixation technique. If this fracture happened, the pieces of bone can be in-placed, penetrate the skin, or move out of it placed. If the bone is penetrating the skin, it requires immediate surgery in order to restore the bone and to reduce any infection that can be happen within a minute. The plate will be placed on the tension side of the olecranon, which is the dorsal side. Later, the screw will be placed at the center of the bone in order to keep the fracture straight. For tension band wire technique, this technique is suitable for transverse fracture of olecranon bone. For the method, make sure that hook of the key wire is posterior. The tension band wire is close to the bone, so there is no laxity in the fixation and instability. Use 6.5 mm intramedullary screw, and the screw need to be supplemented with tension band wire. Lastly, this screw fixation may need a washer to capture the tension of the band wire. Elbow dislocation is the joint surface of the elbow separated from its part. This injury usually occurs after trauma, which is fall or accident. This elbow dislocation can be complete dislocate or partial dislocate. Complete dislocate is the joint surface of the elbow are complete separated. It can be very painful and the arm will look deformed. For partial dislocation, which is subluxation, it's only part of the joint is separated. It's hard to detect and it can be very painful too. For acute treatment of elbow dislocation, you can use medication. Second, try to immobilize your elbow by using splint or sling. Next, you can practice early motion exercise. For elbow relocation technique, first, place your other hand at the top of the patient elbow, which is at the brachial side, and the other hand is placed at the patient wrist. To start the relocation technique, make sure your hand at the patient wrist is pulling the patient hand, and the other hand at the top of the patient elbow is pushing downward in order to restore the bone in its place. For the surgical treatment of elbow dislocation, first, the doctor may restore the bone alignment. Second, they will repair the ligaments of the elbow. Next, they may use wire and pins to hold together during the healing process. Lastly, they may protect the elbow by using external hinge.
Tennis elbow, lateral epicondylitis, occurs due to inflammation, soreness, and appear as pain on the lateral side outside of the elbow. This degeneration of the extensor carpi radialis brevis usually seen in patients who perform manual labor or sports which require twisting and the extension of the wrist against resistance. Differential diagnosis radial tunnel syndrome. The pain of radial tunnel syndrome is very similar to tennis elbow pain. However, the location of the pain is distal to the lateral epicondyle and it relates down the forearm. If the symptom of the tennis elbow is not improving with treatment, rule out radial tunnel syndrome. Golfer elbow, medial epicondylitis, inflammation, soreness or pain in the medial side, the inside of the elbow. The pain or care due to overuse or overload activity which is aggravated by movement of the wrist. Causes of injury of tennis elbow and golfer elbow. It can cause of repetitive flexing, gripping or swinging activity. Then improper technique in any kind of sport. Then extensor carpi radialis brevis position means, for example, during ground stroke backhand in tennis, when ECRB is weakened from overuse, microscopic tears from in the tendon where it attached to the lateral epicondyle. This is the treatment for golfer and tennis elbow. It includes rest, ice, NSAID, which is non-steroidal anti-inflammatory drugs. Use a brace, reduce the load on, and perform ROM exercise to increase flexibility. First, you can use a brace that put the pressure on the injured area. For example, tennis elbow, put the pressure on the lateral epicondylitis which is outside of the elbow. Next, reduce the load on work. For example, repetitive movement and get enough rest. Next, you can also apply ice on the injured area to reduce swelling. Then take anti-inflammatory medication which is to reduce pain. Then you can apply spot massage therapy to reduce pain and swelling.
Range of motion exercise also can be introduced after the swelling has subsided. Gradually increase the load on the exercise to attain more strength for your injured elbow. Cubital tunnel syndrome is a compression of the ulnar nerve at the elbow region. Cubital tunnel is not uncommon. It is the second most common nerve compressions in the upper extremity after carpal tunnel syndrome. The ulnar nerve originates from the medial cord of the brachial plexus. The nerve runs down the arm where it passes under the medial epicondyle of the humerus. The ulnar nerve travels through a tunnel of tissue which is cubital tunnel that runs under the medial epicondyle. As the ulnar nerve passes behind the elbow, it may become compressed or irritated. Causes of injury, which is elbow bend for a long period of time, a direct blow to the inside of the elbow, and nerve slide out from behind the medial epicondyle when elbow bent. The symptoms of cubital tunnel syndrome are worsened by performing activities that require bending of the elbow which stretch the ulnar nerve. Straightening the elbow or extending the elbow will relax the ulnar nerve. Pressure on the nerve at the elbow can cause numbness or pain in the elbow, hand, wrist, or fingers. Cubital tunnel syndrome treatment has two, which is acute and surgical treatment. For acute treatment, anti-inflammatory medicine can be prescribed from the doctor. Next, bracing or sprinting at night and nerve grading exercise. This is the example of exercise: elbow flexion and extension. For surgical treatment, which is the doctor can recommend cubital tunnel release and ulnar nerve anterior transposition. The first treatment for surgical treatment is ulnar nerve anterior transposition. In many cases, the nerve is moved from its place behind the medial epicondyle to a new place in front of it. Moving the nerve to the front of medial epicondyle prevents it from getting caught on the bony ridge and stretching when you bend your elbow. This procedure is called an anterior transposition of the ulnar nerve. For these cases, the nerve is moved on top of the muscle, which is subcutaneous transposition. Next surgical treatment is cubital tunnel release. In this operation, the ligament roof of the cubital tunnel is cut and divided. This increases the size of the tunnel and decreases pressure on the nerve. After the procedure, the ligament begins to heal and new tissue grows across the division. The new growth heals that ligament and allows more space for the ulnar nerve to slide through. Cubital tunnel release tends to work best when the nerve compression is mild or moderate and the nerve does not slide out from behind the bony ridge of medial epicondyle when the elbow is bent. For cardiovascular exercise, riding a stationary bike is the best choice for exercise. Heart rate must be 60% to 70% of max heart rate. For flexibility, which is stretching exercise, we include elbow bend and straighten, forearm rotation, elbow extension, and lateral epicondylar stretch. Do this for 20 reps, 2 sets, and 20 seconds rest between.
So bend your elbow like a flexion movement, like that, and then straighten your elbow like an extension. So you must do it as far as possible. So sini elbow is at your side, and then bend it to 90 degrees, okay, and then palm up like a supination, and palm down like pronation. So you must do it as far as possible. Put your elbow on a soft surface. You must do the exercise on a soft surface, and then elbow on the edge. You're on the edge of the chair, or you can use any other equipment, and straighten your elbow and until the hand feel mild to moderate, and use the other hand to push the hand down for flexibility. Use your hand and then hold your elbow out and away from the body, and hand in flat position, and then pull palm towards your forearm, just like that, for flexibility.
For strengthening exercise, this exercise include static bicep, static tricep, bicep curl, tricep extension, wrist extension, and wrist flexion. Do this for 10 reps for 2 sets and 30 sets rest when you set.
First, the person must bend 90 degrees and then palm up, and use the other hand to push up against the hand. So it will be like this. See, hand pushing up while the other hand is against the hand, and hold up for 5 seconds and for 10 repetitions, and you must do the exercise as hard as possible without pain. Same like the static bicep, but the different move. So bend 90 degrees and then palm facing inwards. It's like a knuckle. And then use the other hand to be the defense of the hand and push down against the other hand, just like this. So push down. So do it for 5 seconds for 10 repetitions.
For functional tests of any sites, functional tests include AROM, PROM, and resistive range of motion, and special tests. Okay, now we're going to demonstrate the AROM, which is active range of motion. Okay, for elbow flexion and extension, first one is flex your elbow to full range of motion. For the extension, extend your elbow to full range of motion. Then the next one is for supination and pronation. For supination and pronation, your elbow must be in 90 degree. Don't abduct your elbow like this. It must be stay in this position. For supination, rotate your arm externally. Next one is for pronation, rotate your arm internally. Sorry. Okay, that's for the arrow. Next, we're going to demonstrate about PROM, which is passive range of motion. For elbow extension, extend the arm and check the elbow like this. Extend. For flexion, flex the arm and check the elbow. The next one is pronation and supination. Rotate the arm, supination. Check the elbow. Next one is for pronation. Rotate your arm internally for supination. If you feel pain at the elbow, the result is positive. Now we're going to demonstrate about resistive range of motion. The first one is for your arm must be in 90 degree. So for the flexion, flexion must resist the motion. Okay, flexion. Okay. Next one is extension. Okay. The next one is for supination and pronation. For pronation, okay, for supination, okay.
For the functional test, we're going to do Vidz syndrome special test, which is we're going to do elbow flexions. First, the patient needs to flex their both elbow and make sure the palm is facing forward. Extend the wrist and hold for 1 to 2 minutes. If you feel pain, numbness or tingling in the area of your arms until your pinky finger, that means the result is positive. For the next test, we're going to do ulnar compression test. So, the patient must to flex their elbow and make sure the palm is facing forward. Extend the wrist and the other hand press at the nerve side for 60 seconds. If you feel pain, numbness or tingling or burning at your arms until your pinky fingers, that's mean the result is positive.
I'm going to demonstrate you about valgus instability stress test. Okay, the first thing is make sure the patient in standing position, fixate the humerus, and check for the ulnar collateral ligament, which is just below the medial epicondyle. Okay. Next one is your other hand must be at the wrist. Make sure the elbow in 20 or 30 degrees, like this, and apply the valgus force, which is abduction. If you feel pain at the elbow, that indicates the result of positive. Now we're going to demonstrate about the varus instability stress test, which indicate the radial collateral ligament. First one, the patient must be in standing position, and then fixate the humerus and check for the radial collateral ligament. Next one is other hand must be at the wrist and elbow flex to 20 to 30 degrees and apply the varus force, which is abduction. If it feels pains or increase in laxity, the result is positive.
Is lateral epicondylitis test, which is this test called Mills test. Okay, for this test, make sure the patient is standing position, fix the humerus, and check the lateral epicondylitis, which is outside the elbow. Then supinate the forearm, extend the wrist, and extend the elbow fully. The result is positive if the patient feel pain. Okay, next we're gonna demonstrate medial epicondylitis test, which is for golfer elbow. Okay, ensure the patient in standing position, fix the humerus, and check the medial epicondylitis. Then supinate the forearm, extend the wrist, then extend the elbow fully, like this. The result is positive if patient feel pain.
For the recommendation, do the stretching before and after exercise. Second, adjust the workstation. Third, rest when do the exercise. Fourth, prevent from falls and slips. Fifth, avoid overuse throwing.
So the conclusion, patient need to follow the rehabilitation session that was recommended from the therapist, which is always consult to the therapist before do exercise. Then rehabilitation must be executed according to the condition of the elbow. Means do not do exercise in the early stage of injuries. Lastly, patient itself must have knowledge about injury rehabilitation, which means to increase awareness about the injury and take care properly.